I have to say that when I started this 21 years ago, I had no idea that it would all come to all this. And probably, perhaps, one of the best things that's happened is I've met some of the most finest, upstanding human beings that I've ever met in my entire life. I'm serious. Noble, people that are sick that still want to fight, people like Sandy, who fighting for the life of her son. And then, I realized it was time. And for historic reasons, I'm an injured worker consultant on the actual California ballot. Okay, they did not want to put that on when I went running for Congress. Injured worker, you can't be an activist, you cannot be an advocate. Certain words cannot be used, and they wanted to avoid injured worker like the plague. So I say yes, I'm going to be the insurance company's worst nightmare. What I've learned through the worker comp system since 1989, I wanted to find out why I couldn't get my workers' comp. Then I had a bunch of Kaiser workers that I worked with, they couldn't get their workers' comp. And this is with people with management that were predatory, they were abusive, they worked in filthy environments, they short-staffed them by making them work really hard, they broke their bodies. Mine is one of them. I don't look like it, but let me tell you, there are railroad tracks inside this body. Not outside, so I started out helping because I found out that we had 6 suicides in one small facility in South Sac, about 300 employees. Then there was a murder, and then there was another suicide, but the murder occurred in South Sac as well. So in 1992, I proclaimed myself to go, I'm going to help all these workers, and I'm going to go get justice. Well, look at me today. Here I am running for Department of Insurance Commissioner. My biggest thing is because people today cannot get their health care taken care of. I don't care if you're an injured worker. I don't care if you're a regular patient, because even with the patients that have mold can't get care. People that I know, like my daughter, she can't even claim that she has a work-related injury, but she has injuries. They do not want to take care of it. They want to give her conservative meds. I don't care what kind of health care plan that you have. Conservative, but they don't mind charging you top premium dollar to give you conservative treatment. They won't tell you what you're diagnosed with. We have children that have asthma. We have children with respiratory problems. They cannot be told. Their parents aren't told what these children have. Oh, well, maybe it was something in the food. Maybe it was something in the water. Maybe it's something in the air. But we're not going to tell you what it was. We're just going to give you an antibiotic. We're going to give you, what I worried about, I think the hardest thing I had to worry about is my daughter just gave birth to she's 2 months old. I have a grandson that's 2 years old. I have a granddaughter that's going to be 12. They've all been sick with respiratory problems. We didn't have that problems. I grew up in Chicago. It's cold. It's got the almighty hawk. It's windy. We didn't have those problems. We had occasionally allergies here and there. We didn't have all the problems that people are faced with today. So I don't worry about myself anymore. I'm kind of an older woman, so I don't really care. It can't do a whole lot to me anymore, But, I'm worried about my kids. They're 30s, they're 20s, okay? Their bodies are already broken. I worry about my grandchildren because they've already been exposed to God knows what, And what I was thinking when Becky was talking, I had already Frankenstein in my mind, by the way. I do all these little metaphors, okay? So I already had Frankenstein, but I had Dr. Jekyll and Mr. Hyde of the the industrial medical complex. I believe that they're making people sick because then they can sit there and make more money. They have more reason to come up with those little machines you were talking about, nanotechnology. Okay, then you can start, to me it's a depopulation. You can kill people in many ways. Make them sick, take their money, give them false hope that they're going to be cured, and when in fact you're making them sicker. So what I'm saying is that HMOs, insurance companies, they're there to make you sick and they're going to make you die, but you're going to pay through the nose before that, and you're never going to know what was wrong with you. So in ending, I just want to let you know is I had no idea that I'd be running for insurance commissioner, but I will let you know is that I know that the insurance companies, the pharmaceutical companies, the chemical companies, the legislators damn them to hell for allowing all of this, for allowing them to hurt all of us. We voted for them. We give them money. We put our hope in them. They've betrayed us. So I want to let them all know, put them all on notice. You know, insurance companies are out, people are in. Profit is out, people are in. So, you know, if you want to, you go ahead and vote for me. I guarantee you, I know just a little bit more than the last guy who's a billionaire. Thank you.